Hello, future nursing students. Quite often we will be doing online lectures, so this one will give you a little bit of a start to it. Forgive the noise in the background. My dogs are playing right now. Of course, they've been sleeping for hours, and as soon as I start trying to do something, they come to life. But anyways, I'll show you them really quick. Oh, they're going that way now. That's Chip and Willow. We've had Chip for a year, and Willow just joined our family. She's about 2 years old. All right. So anyways, this is going to be covering Chapter 4, the Complete Health History. This is a PowerPoint that one of my past colleagues developed, Katie Drury, and that we have been using for a few years now regarding this chapter. It's probably good for you to look at your book as I go along with this, because I will probably direct you towards page numbers and specific things that I want you to know. I will not go over everything in great detail. Of course, it is up to you to read the chapter to get all of those specific things. Objectives are for this lesson are defining the purpose of the health history, listing the parts of the health history, talking about the analysis of the symptoms and the 8 variables that go along with that, and describing modifications for both culture and for developmental levels. So, what do you think is the purpose of a health history? Think about that for just a moment. So, the purpose of the health history, and I'm just looking in the book to kind of give you an idea. If you look on page 49, the very first line talks about what the purpose is, and that is to gather both objective and subjective data. So we have 2 different types of data, which we're going to talk about in the next slide a little bit further, objective and subjective. Objective is the type of data that we can see, the type of data we can measure, we can touch, we can smell, we can feel. So that's very objective. It's kind of like it's almost black and white, because we can visualize it, we can see it and understand it. Versus subjective is what is described to us by the patient. So it's how the patient lets us know they are feeling. They are telling us they have a headache. We can't see it. We can't see a headache. We can't see a sore throat. We can't see a stomach ache. We can't see a fever. We can measure these things we can measure a fever. Obviously, we can take a temperature and we can see if the patient has a fever at the time, but we can't measure a headache. We may see them going like this or like this. They're describing it to us, and we can see signs and symptoms that relate to that. So the purpose of the health history is to go over all of the things that they are telling us, plus adding in the things that we are actually seeing, measuring, something concrete to go along with that subjective information. So when we gather data, we're looking at gathering 2 different types of data, the subjective and the objective, as we talked about. So remember that subjective is considered a symptom. You've heard of signs and symptoms before. So subjective is the symptom, because they will describe to us what their symptoms are. Remember, subjective is what the patients say, how they describe their health, things that you can't verify through signs. So obviously, if subjective is symptoms, then objective is signs. These are things we can observe. These are things we can see or touch or feel or hear, all of those things that we talked about. So there are different ways that we gather this information, and this is important for you to know as well. We measure these things. So we may take vital signs. We may check their blood pressure, their pulse, their respiration, their temperature. But we're measuring these things in some way. We're measuring this data. It could even be measuring like the size of a wound, or maybe doing the circumference of a waist, or doing the circumference of a calf because they have swelling in their leg. Inspection is looking. These are things that we are looking at. So we're inspecting for these things. So we're looking for particular things. Palpation is next. Palpation is touching, feeling, using our fingertips, usually the pads of the fingers, to actually touch. We may feel warmth. We may feel swelling, like we can feel fluid or edema in there. Maybe something feels hard. Maybe something feels rough. But we can palpate it. We can actually touch it. Percussion is making a sound when we're tapping. So we have to tap something. I always try to liken this to, in a band, you have the percussion instruments, which are typically like the drums, for instance. So you're tapping to make the noise. So for percussion, we would put our fingers on the person in a particular spot, and we tap on that with our other fingers. But we actually go like this. It's a nice little flick of the wrist. And you'll learn how to do that as we go along. And then auscultation is listening. So we can listen with our ears. We can listen with a stethoscope, maybe with an ultrasound. So those are all of our ways that we gather that objective information. All right, so the health history sequence it goes in a certain way, and this is the way that we want you to do it. And we'll go over each of these a little bit more in detail in the next few slides, but they start on page 49. The biographic data, the reason for seeking the care, present health or history of the present illness, which is also known as HPI. The past history, medication, reconciliation, family history review of systems, and the functional assessment. So we will go over each of these in the next few slides. So the biographic data, this is about the patient, kind of telling us who the patient is. What is their name, their address, their phone number, all of those things that you're asked whenever you go into a medical facility. Birth date, ethnic origin, so they're really playing and I'm really sorry. Ethnic origin, you know, their race, their... Hold on. Sorry about that. I don't know if I calmed them down or not, but so you know what their race is, what their ethnicity is, what they do for a living, their occupation, what language do they speak, what is their primary language, are they able to speak English if we're English speaking, obviously, who is it that's providing the information to you? Is it the patient themselves, or is there a caregiver with them or somebody with them that is telling you the information? And that person, the reporter, are they reliable? Is the patient reliable? Is the patient telling you things that don't match up with what you're seeing? Is the person telling you things that don't seem to be matching up with what you can see with the patient? So how reliable is that reporter? The reason for seeking care, why is your patient presenting to the care setting? Why are they here to see you? What is their main complaint? This just consists of a couple signs and symptoms along with the duration. So how long has it been happening? Remember, this is not a diagnosis. So this isn't something where we say, oh yeah, you probably have strep throat, you have a sore throat. This is where we're just measuring those signs or observing those symptoms or having the patient describe those symptoms to us. It's very important that nurses know that they do not do medical diagnoses. We have things called nursing diagnoses, which are very different. A medical diagnosis tells us exactly what's wrong with the patient. So you have a patient that comes in and says that they've had a sore throat for several days. They have a fever. They have white patches on their in their throat. You can look and you can see the white patches on the tonsils. You measured their temperature. They have a fever. It just looks like it's strep, and you say, yeah, looks like strep to me. Or you write in the chart, patient has strep throat. Well, we don't know that. We don't know that yet. They very well might have it, but you can't make that determination. So don't ever diagnose the patient. If the patient comes in and says, I have a cold, you're not going to write down patient has a cold, because a cold is a diagnosis. You're going to say, tell me what makes you think you have a cold. Tell me the symptoms that you're having. So then they'll say, I have sneezing, I have watery eyes, I have a bit of a cough, runny nose, all of these signs and symptoms of that. But we can't make that determination that it truly is a cold, because it may be something else. So be sure that whatever the patient tells you, you ask what signs and symptoms are and list those. Don't list what they think they have. So it's kind of like a title to the patient's story. Present health, history of present illness. This is on page 50 in your book. You can look over all of these things. Healthy person is very simple. If they say they're healthy and they don't have any problems, that's all we need to do. However, if they do have an illness or they have something wrong with them, then we need to look at the 8 critical characteristics. So these are all listed on page 50 and 51. I really want you to look through these, read through these, and really understand them, because these are key to every time a patient tells you they have something going on, you have to go over these 8 critical characteristics when you're talking to them. So the location, where is the problem? As we talked about with the throat, it's in their throat. The character or the quality. So specific descriptions. What type of pain is it? Describe the pain to us. Is it stabbing? Is it a constant pain? Is it a dull ache? Just describe that character or the quality of it. The quantity or the severity. If you look at that one, so quantifying exactly what it is. So the book gives you the description of someone who says they've had heavy menstrual bleeding. Well, it might be easier to say, how many pads are you wearing at a time? How often do you have to change, and how full are the pads? So that can kind of quantify it. You can see that. The timing, how long has it been going on? When did it start? The setting. So what happened? What were you doing prior to this? If it's an illness, that's a little different, but if it's an injury, it's really important to know what that person was doing. Aggravating or relieving factors, things that make it feel better, relieving factors, things that make it feel worse. Associated factors to go along with it is this primary symptom associated with any others. For instance, along with that sore throat, maybe they have ear pain, maybe they have a headache. People with strep throat often get stomach aches as well. They get upset stomachs. So asking about those other things that are associated with it. And then the patient's perception. And I think this is one that is really, really important. How is it affecting their life? How is it, how does it affect what they do on a daily basis? All of you have been through CNA class, or you're going to be going through CNA class. And in CNA, you learn about ADLs, activities of daily living. So these are getting dressed, making your meals, cleaning, doing your laundry, all the things that the patient does for themselves. How does this symptom that they are describing, how does this affect their life? We need to know their perception of how that affects them. Another good one to think about is pain. And actually, I'm almost out of time. Each of these screencasts can only be 15 minutes. So I'm going to stop this one, and then I'm going to start the next one, and then we'll go over a little bit more on patient's perception.